One of the topics that often comes up during our treatment planning session with our patients is that when can I get a filling as opposed to requiring a crown? And in order to answer this question, we have to look at the extent of the problem. For example, if the patient has a very large cavity, by the time we remove the defected portion of the tooth, what we're going to be left with is minimum tooth structure. And in order to protect that minimum tooth structure, we have to cover it with a full coverage crown. Whereas if a patient has a very small cavity that requires minimal tooth structure removal, then at that point, majority of the tooth is solid and healthy. So we can just fill in the portion, that small portion that was removed during cavity excavation, with a little filling. So what this should mean to a patient is that it's always better to address cavities during early stages when they're small, because that can be done with a small filling. And if we look at it from a cost perspective, a filling is much affordable compared to a full coverage crown. So if you don't take care of it during those initial stages and you let that cavity take over the tooth, by the time you're ready to treat that cavity, you may have lost so much tooth structure that now you need a crown. And again, if you look at it merely from a financial perspective, doing a crown is going to cost much more. Not to mention, we always want to maintain as much of a natural tooth structure as possible. So again, taking care of that cavity in early stages is a much better option than delaying. Hope this helps. We are located in Fountain Valley. If you have any other dental related questions, please feel free to look us up online or give us a call at the office. Thank you.